Hello, and welcome to Yinstil Reproductive Wellness, world leaders in complementary reproductive medical care since 2004. Acupuncture and fertility. Unveiling the core mechanisms. Acupuncture is a therapeutic modality rooted in traditional Chinese medicine, or TCM. Its ability to influence fertility is through a variety of interconnected physiological mechanisms. The primary mechanisms include the modulation of neurotransmitters, the regulation of the hormonal system via the Hypothalamic-Pituitary-Ovarian HPO axis, and the balancing of the autonomic nervous system. Neurochemicals. The insertion of fine needles at specific acupuncture points on the body is known to stimulate the release of various neurotransmitters that play crucial roles in overall health and reproductive function. Among these are endorphins, often described as the body's natural painkillers. These peptides bind to receptors in the brain, alleviating pain and fostering a sense of well-being and relaxation. Furthermore, acupuncture has been shown to influence the levels of serotonin and dopamine, neurotransmitters vital for regulating mood, sleep patterns, and appetite. By modulating these chemicals, acupuncture can positively impact mental health and overall well-being. Norepinephrine, another essential neurotransmitter influenced by acupuncture, plays a key role in the body's stress response. Stimulating its release can help regulate this response and promote relaxation, making acupuncture a valuable tool for managing stress and anxiety. Oxytocin, often referred to as the love hormone, is involved in social bonding, trust, and stress reduction. Studies have shown that acupuncture can influence the release of oxytocin, which may help improve emotional well-being and reduce stress levels, particularly benefiting individuals experiencing anxiety, depression, or other mental health concerns. And finally, gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter, is also affected by acupuncture. GABA helps to calm the nervous system and promote relaxation. Research indicates that acupuncture can increase GABA levels in the brain, contributing to its calming and stress-reducing effects and potentially improving sleep quality, which is essential for hormonal balance and reproductive health. Hormones. Beyond neurotransmitters, acupuncture exerts influence on the hypothalamic-Pituitary-Ovarian HPO axis, a central regulatory system governing sex hormones critical for fertility. This axis involves a complex feedback loop between the hypothalamus, pituitary gland, and ovaries, controlling the production and release of hormones such as estrogen, progesterone, luteinizing hormone LH, follicle-stimulating hormone FSH, gonadotropin-releasing hormone, GnRH. Research, particularly animal studies, suggest that electroacupuncture can normalize the functioning of the HPO axis by affecting the serum concentration levels of these reproductive hormones throughout the menstrual cycle. By modulating the HPO axis, acupuncture holds the potential to address hormonal imbalances, a significant contributor to infertility, thereby influencing ovulation, menstrual regularity, and the development of a healthy uterine lining necessary for successful conception and pregnancy. The nervous system. Acupuncture interacts with the autonomic nervous system, a critical component of the body's physiology that controls involuntary functions. The ANS comprises two main branches. The sympathetic nervous system, responsible for the fight or flight response to stress, which promotes the release of cortisol and raising heart rate, blood pressure. And the parasympathetic nervous system, responsible for the feed and breed response, which promotes relaxation and resource allocation to the digestive and reproductive systems. In the context of fertility, chronic stress can lead to a dominance of the sympathetic nervous system, potentially hindering reproductive functions by reducing blood flow to the pelvic organs. Acupuncture has been shown to modulate the nervous system, helping to shift the balance towards parasympathetic activity. This shift can promote a state of relaxation and increase blood flow to the reproductive organs, including the uterus and ovaries. Improved blood flow is crucial for various aspects of fertility, such as the development of healthy eggs, the thickening of the endometrial lining, and successful embryo implantation. The ability of acupuncture to influence the ANS highlights its potential to counteract the negative effects of stress on fertility by fostering a more conducive physiological environment for conception. A special thank you to everyone involved in doing the research to better understand acupuncture and its impact on fertility. This important work supports informed clinical decisions for the practitioners and patients at Yinstill.